Welcome to the Trauma Acute Care Surgery or Surgical ICU service within the Division of Trauma Critical Care. This is a brief introduction to the orientation for each of the services included in the electronic copy of the orientation packets that you received via email. You should review the electronic copy more thoroughly for your respective service. I'll first discuss the shared themes for the three services and then describe the nuances of each service. The 11 Trauma Critical Care faculty staffs the three services. In addition, there are 6 advanced practice providers that are a valuable educational resource for you. Day to day and at night, there is 1 faculty assigned to trauma, 1 to ACS, 1 to SICU, and 1 flex backup faculty. The flex faculty is available if the primary faculty is too busy to address patient issues and to prevent backlog. On weekends, the primary faculty will round on their service and then sign out to the on-call faculty. Any changes in the rounding faculty will be told to the residents. At night and weekends after rounds, all new patient notes will be co-signed to the on-call faculty. Morning report usually occurs in the trauma offices at 7 a.m. each weekday except Tuesday and Wednesday, and all residents, including night float and students, are required to attend to discuss new patient admissions, all ACS and trauma patients in the ICU, and operations for the day. Morning report occurs at 6:30 a.m. on Wednesday and 8:15 a.m. on Tuesdays in Conference Room H. There are several conferences, including Trauma Conference at 6:45 a.m. on Tuesday morning, Surgical M&M and Grand Rounds, depending on the week, at 7 a.m. Wednesday morning, and SICU Case Conference and Journal Club 7:30 a.m. every other Friday morning. Attendance for all conferences for residents and students is mandatory. Patient care will be covered by faculty and APPs during conference. All notes and procedures should be marked as co-signed to the assigned day faculty for that service or on-call faculty at nights and weekends. All procedures and anything invasive on a patient for any of the services requires faculty notification. No duty hour violations for students or residents are tolerated. You are responsible for maintaining your own duty hours, and if near violation, your senior resident and or faculty are to be notified before violation occurs. Please check your email for call schedules and orientation packets. The trauma service. Daily patient rounding times will be determined by the primary faculty each day and weekend. Please view and review as many times as you wish the trauma resuscitation video on YouTube, especially before your first call. Every trauma patient will have a tertiary survey performed within 48 to 72 hours of admission. If the patient is in the SICU at this time, the TERT will be performed by the SICU residents. Patients with 2 or more injured systems will be admitted to the trauma service. Any other plan should be at the senior resident or faculty level. There are dedicated separate junior medical student teaching rounds with faculty that the 4th-year students are welcome to attend. The ACS service. Daily patient rounding times will be determined by the primary faculty each day and weekend. You will receive a laminated pocket card describing the fast-track protocol for uncomplicated laparoscopic appendectomies and cholecystectomies. The SICU service. Daily patient rounding times will be determined by the primary faculty each day and weekend. The SICU service is a consult service. Communication between the SICU resident and primary team is essential. The SICU is not a closed unit, therefore plans on patients should be discussed with the primary service. If there is a bed crunch or questions about admission to the SICU, this should be bumped up to the fellow or SICU faculty level after you have evaluated the patient. If a surgical fellow is present, then the resident will discuss all plans with the fellow first and then discuss with faculty. See separate handout. All procedures require faculty to be notified. Lastly, welcome to the Trauma Acute Care Surgery or SICU rotation. If there are any questions or concerns, do not hesitate to discuss the issues with your senior resident or faculty, whether they are on service or not. Finally, please check your email for call schedules and read the orientation packet for your rotation that was sent electronically. Thank you.